What's up, Dr. Murphy? What's up, guys? It's Dr. Murphy, the Murphy Medical Associates, and our team at coronatestct.com. That's right, coronatestct.com. Here today, August 22nd, 2021, for the great tropical storm Henri. We're here in the studio today, so let's have a little iced coffee, shall we? Right? Little iced coffee, we get ready for the media hype known as Hurricane Henri. In all seriousness, though, tropical storms come and go. And last year we had some serious issues with some power outages, resulting in us running our laboratory off of a generator for 5 days. Not like a Generac generator, but we would have to go run out, pour gas into our generators that were hooked up to our lab equipment. We had to do this for 5 days. Do I expect this to happen again with Henri? Stay tuned. You're going to find out. You're watching Murphy's Medical Minute. All right, guys, let's take a look-see. Let's see what we got. We'll go to the Weather Channel. We're going to go to the Weather Channel here. Right, as you can tell, let's see if we can open this up a little bit. We'll open this up for you a little bit. Maybe I'll share my microphone. What do you think? I'll share my microphone? We'll talk a little bit about what's going on here. So let's take a little look-see and see what we got. Right, Henri is approaching Long Island. Yes, look, congratulations. YouTube gets a free ad on my behest.
I'm not dressed for that. When you want the real deal, like a good neighbor, State Farm is there.
That Henri has been downgraded to a tropical storm, just like Reynolds Wolf gave us that update. It's still moving north at 18 miles per hour. And like Steph said, we're kind of waiting for it to get pulled maybe a little bit to the north and to the west, the center of it itself. We're already seeing that oblong shape. And, you know, most of, you know...
So you can see here what I'm looking at is that the storm is going to hit Rhode Island, maybe New London out at the Coast Guard. But the big issue is going to be all of this rain.
Trenton, Middlesex, and kind of touching the Philadelphia area. But if we just focus on the current watches and warnings right now, even though it's a tropical storm, we still have the hurricane warning that it's in effect right now, exactly where Stephanie is over there in Montauk and much of Long Island, and that continues for New London and New Haven. Even if you don't get those, you know, 70, 75 mile per hour gusts in those areas, I mean, still 50, 60 mile per hour gusts are going to cause problems too. So the high cloud tops you can see stretching all the way over into New York. We had, you know, record rainfall yesterday, daily record rainfall for Central Park. They picked up more than 4 inches. A lot of that rain is still yet to come, which I think, you know, flash flooding.
I don't see the rain here.
Problem, a big widespread problem.
Just yet.
And
we're in Fairfield County.
The waves are getting gnarly out there. All right, we could be looking at swells 8 to 14 feet. All right, depending on where you are. Maybe out towards Nantucket is where we're going to see some of the largest waves.
Yeah, you know,
getting big where Stephanie is currently.
I looked
so there's your flood alerts
at the marinas, and a lot of the bigger boats were all pulled out here in Fairfield County.
Could be widespread.
There's definitely going to be power outages.
Good chunk of territory here that potentially could go without power today.
Definitely going to be without power.
The only good news here, Kelly, is it is happening and moving on shore during a daytime hour, so you would have that natural light to still help you get to where you need to go and make sure that you guys stay safe. What happens tonight? What is the storm going to do? Is it going to drop to 35 miles per hour, sustained winds within it tomorrow morning? We'll see as it makes landfall, but you can kind of see it'll shift to the north and west, and then eventually it'll be out of here. But Kelly, we're going to be talking about this for several days.
And that is going to be because the power is going to be out for several days. Let me tell you that right now. I will reiterate to you. I'm going to reiterate to you. We'll switch it over here. But I'll reiterate to you guys. The power is going to be out for days. The power is going to be out for days. So what is power out? See, you guys can see the live stream here. We'll see the live stream. We'll put you on here for a little chat. I don't know if you can see it. You see the live stream down there? Right, so, look, Julie Lotto's on here. So we'll put a little hi to Julie. Right, and I'll put my microphone back on. I'll put the microphone back on. All right, we'll say good morning, Julie. All right, so what are we going to talk about today? I want to talk a little bit about the fact that I owe you some work. I'll take care of it today, Julie. So what's going to happen with this hurricane / tropical storm? And I think we have to group this into 3 sets of effects when we look at this. I think the first set of effects that we look at with this is structurally what's going to happen. Structurally for society, what's going to happen from a storm in a small amount of time. And remember, these storms, they have long-lasting effects. In fact, they've had studies done where people have hurricanes, and what they find is incidents of heart attacks go up, incidents of issues in hospitals go up. But what's really interesting about these sorts of storms with high winds and rains is that pollens are whipped up. And the pollens, when they get whipped up, we've seen fungal infections from them, and we've seen allergies, asthma, bronchitises, and even pneumonias. So you just get a big whipping, a big conflagration. And so what's interesting about that, I'll tell you here in the Northeast, is the fact that we did review a couple of studies a long time back, probably in like April of this year, showing that pollen increases your likelihood of getting infected by COVID. Pollen messes up your immune system and prevents you from being able to fight off upper respiratory infections like COVID. Okay, so over the next couple of weeks, we're going to have a bunch more pollen and dust up that's going to affect the lungs as we go out. It's just going to happen, especially out east. Rhode Island is going to get a lot of the wind. Massachusetts is going to get a lot of the wind. Out already where they're at a 5-alarm fire, supposedly, in terms of rate, out in New London, Groton, that area is going to see a lot of wind. So a lot of stuff's going to stir up. That stirring up is going to lead to a lot of different issues. But I think one of those issues is increased respiratory diseases. So that's number one. So structurally, environmentally, right? We'll have some flooding. We're going to see that. Some people may have issues with toilets and sanitation. Those things could be major league issues for people. And so when thinking about all of this, I really want to think about that as the environment. Secondly, what's the storm doing right now? It's going to force all of us in the Northeast indoors. No one's going to go outside today, so everyone's going to be stuck indoors, similar to what we would expect to see with wintertime, right? With wintertime. We just had that big homecoming concert in New York City. All of those people are going to be packed indoors today. They'll all be packed indoors today, bringing whatever that they were exposed to from the outdoors. Now, traditionally, I'm not really spooked about the outdoors because, you know, there have been studies that show you're between 12 to 18 times more likely to catch COVID indoors than outdoors. So the air mixes and it's a lot better, but there have been some studies about outdoor transmission. So that worries me a little bit. In addition to that, there's going to be a whole bunch of people that maybe don't have their medications. If they don't have their medications filled, you're going to have exacerbations of other things. Heart disease, heart failure, high blood pressure going up. And those are the things that they've seen in the studies when hurricanes or natural disasters come. My concern really through all of this is a big concern for the people who are on medications. I'm not so worried about people who are not on medications. And that'll affect the humans and the human condition. But I think the third thing that's going to happen here, is we've taken our eyes a little bit off the prize, And what does that mean? What does that mean? We've been distracted with a lot of other different things. Afghanistan is coming, has issues that I'm not going to get into. The tropical storm / hurricane Henri has issues that I'm going over right now. But more important than any of that, what I really want to go over, and I'll tell you right now, is the fact that our strategy in public health with trying to boost our way out of all of this stuff is just a hot mess. It's a hot mess. And I think, the FDA Monday is going to approve the vaccines fully. And there's a lot of talk about writing things off label. Let me tell you, I've written medications off label before. That's absolutely the case because we have evidence, whether it's anecdotal evidence or whether it's clinical trial evidence, that is not strong enough for the FDA to make the bar pass, but medications that we've used for a lot of people for a lot of different things. One of those things, and they say to this day, if aspirin had to be approved by the FDA, it wouldn't be approved by the FDA based on its safety track record. And I tend to agree with that, the increased risk of bleeding and those sorts of things. But what I'm most concerned about with all of this, and I'll tell you right now, put simply, is that people are talking about writing off-label vaccines. People are talking about writing off-label vaccines. So yeah, let's just write an off-label vaccine for my kid. And so it's not without risks. It's not without risks. And so all the people that were bashing folks like Pierre Corey or Dr. Mobeen or Dr. Yogendra, or the literally thousands of doctors with AAPS or with the Frontline Critical Care Coalition, or in so many other different countries that are writing for medications for early treatment. We were one of those teams that wrote for early treatment. We wrote for early treatment all the time. And in fact, did we use hydroxychloroquine in the very beginning? Yeah. So did all the academic centers. When they recognized that they didn't work for inpatients, they demolished the medication. And so this is why I get a little concerned. We have FDA-approved medications, things like Duazobin 1 and 2, to quote my man over at Peak Prosperity. And we also have, we will have Monday FDA-approved vaccines. So will people use FDA-approved mRNA vaccines off-label? Will they write them off-label? I don't know. I don't know. The problem when writing an off-label medication is that you, the physician, now take medical legal risk for writing the medication. You always had that medical legal risk, but now you're a little vulnerable because you wrote an off-label indication. So will physicians take that risk? Are they willing to take that risk? They now would be transferring the vaccine adverse risk, which normally is pumped onto the governmental entities, right? They have vaccine injury hotlines. It's like Black Lung. They have funds for that. But now you, doctor, would be prescribing that vaccine. And so I'd be very surprised. Oh, hey, Jim, what's going on, man? What's going on? You're down in Texas. Talk about on fire, right? Texas is on fire. Florida's on fire, and the South's on fire because that's the way it is. You know, what's interesting is Jim is running vaccine efforts down in Austin, Texas. It's amazing efforts that he's been doing there. I can't be more proud to be affiliated with Jim. It's just an amazing man. So anyways, so Jim, what's going down in Texas? What's going down in Texas? What are they going to do there when the FDA approves the vaccine formally? And you can write for it. You can write a prescription for the vaccine. Do you think doctors are going to write and take that risk? What do you think they're going to do? No, you're welcome, Jim. Honestly, like Jim just said thanks. So what we got going on is a storm up here in the Northeast, big deal. We've seen storms. They said, oh, a hurricane hasn't hit for 30 years. Well, you know, the big concern I have is the storm surge, right? The big concern I have is the storm surge. And if you take a look up here, look to my right and look to my left, you can see a wide swath of storm surge. Wide swath of storm surge. And so one of the concerns is that the storm surge is going to knock all the boats out of the water. It's going to move all the traps. The oyster beds are going to be a mess. In addition to those things, and probably more concerning, is Eversource is going to make a complete hash of it. And I don't know if you know this, but in Connecticut, we sued the power company because they failed to properly restore power for people. And we're talking hundreds of thousands of people. And with this storm, they say, you know, even Eversource says, you know, about 70% of our customers are going to be without power. So that's why I'm live streaming right now. So if you haven't got your medications up here in the Northeast, you better go get them very soon. In addition to that, oh yeah, no doubt, right? So in addition to that, you're going to be packed indoors. And so you got to make sure you have ventilation that's proper. And the Corsi Rosenthal boxes are amazing. Jim just said in Austin, they'll continue, Abbott is going to continue to push individual choice. So schools are already seeing huge clusters of COVID-19, COVID positivity. And I got to tell you right now, I'm going to tell you, put simply right now, we can talk all this garbage about individual choice, and it drives me crazy, right? Life, liberty, and the pursuit of happiness, remember, I'm there. But when your actions impair my life, then we got a problem. And that's the way the United States has always worked. But I'm going to tell you something that's probably the biggest frustration I have out of all of it. Probably the biggest frustration that I have. I'm going to see if I can show you a picture of it here. I'm going to see if I can transmit one of these so you guys can see what it is. Because this is going to be the lifesaver. This is going to be the lifesaver for, let's see if I can get one for you here. All right, I gotta close that. Bye. All right, let's see if you guys can see this. I don't know if you can here. Yeah, there you go. Good. So I'm gonna blow this up bigger for you guys. You take a look at the bottom here. Take a look at the bottom here. You see that thing right there? That is called a Corsi Rosenthal box. That is, yeah, Julie, you're totally right. You can choose to kill my kid. Yeah, no, I agree with you. So let's get it back. Let's get it back. So this is the Corsi Rosenthal box. This is a Corsi Rosenthal box. You know how they say teachers have to go and supply kids school supplies because the funding at the school district is not okay? Well, if you're a teacher, the first thing you need to do to save yourself, to save your children, especially in states like Texas where they're going to have individual choice, is you need to go and build yourself a Corsi Rosenthal box. Do you guys see what those are? The Corsi Rosenthal box was developed by two air quality engineers. These are two air quality engineers. And what they have put together is nothing short of amazing. It's nothing short of amazing. I'm going to see if I can get it here for you in the specs. Right, I'll pull the, let's see if I can pull the specs over while you see the Corsi Rosenthal box. So I'll put that right next to it. Do you guys see this? All right. So this is a Corsi Rosenthal box. These boxes are designed to maximally filter air. They have amazing air filtration qualities about them, and they're dirt cheap to buy. I can tell you right now, I bought 10 of these box fans. These little box fans, the 20 by 20 box fans, and furnace filters. And we use the MERV 13 furnace filters. And then we make a fan box shroud from the box, from the fan box that you have. And then you duct tape it all together. Can you see here? You take a look at how these guys use painter's tape, right, to make the shroud. But what you can do is you take the box and make a shroud with it. And these air filters, these box fans, are some of the strongest filtration units you're going to have to produce and filter pure air. You can put these in every schoolroom for the cost of $50. I see school districts buying these $1,500 crazy air filters, and most of them don't even work. So what they need to do, and Jim, you need to spread the word on this down there in Austin. They need to go buy PCO2 monitors. They can buy PCO2 monitors and build these Corsi Rosenthal boxes. Then maybe they can get back to school, right? Maybe they can get back to school. So that's my 2 cents with it. I think we need to get a Corsi Rosenthal box. So as Texas kind of rips up a little bit, we have to think about what is going to happen throughout the year. What's going to happen throughout the year. And so I think it's a good point to review what's going on with the hurricane here, right? So the hurricane has been downgraded to a tropical storm. That means that the miles per hour is just 4 or 5 miles per hour less than a hurricane. And it looks like it's going to land in Rhode Island or New London, so out at the end of Connecticut. But what's going to happen is you're going to have lots of floods, and the flooding and the winds are going to be there. And if the floods seep through the trees, what you're going to have is the trees will get ripped down. Trees are going to get ripped down in the Northeast. Roads are going to flood. The trees will land into the power lines, and we're going to have power outages. And so that's why I'm going to live stream, and that's why I am live streaming today. Now, let's see how long I live stream for. What do I got going in my live stream? What do I got going? What do we see here? Look at a little timing. Right, so we got about 10 minutes in. So you guys have any questions for me? Oh no, no data. Ah, there we go. So Julie, yeah, I agree. That's the problem, is like the threat of children under 12 who are not vaccinated, the threat of children who are over 12 who are not vaccinated. And, you know, I don't want to get into that too much, but I'll tell you that let's see, right? The Kaiser Family Foundation basically has said that parental concerns exist, and that a majority, right, of parents say that schools should not require the students to be vaccinated. And 54% of parents say all school-age children should not require vaccination. 54%. 54%, Julie. 1 in 2 parents say that the school should not require vaccination. You see that? Should not require vaccination, even with a fully FDA-approved vaccine. And the FDA is going to approve the vaccine. That's a for certain. The FDA is going to approve the vaccine Monday. It's going to be approved, fully approved Monday. And so how can we, in anticipation of that, with all the power outages, and try and keep a safe school? And I told you that already. The way to keep the school is the boxes. Keep it safe. Yeah, right, it's a simple solution. You take 4 MERV 13 filters. Let's see if I can pull it back up for you. I'm going to say pull it back up for you. I'll pull that little box design back up for you. We'll put it right here, right? So that right below, take a look. That's a Corsi Rosenthal box. You take 4 furnace filters, the MERV 13 filters, a 20 by 20 box fan, and you tape it up. Now, the problem is big business won't like something like this because it's not going to hurt anyone, and it's not going to cost anything. You know, and lawyers aren't going to like it. Oh, who's responsible for the legal manufacture of these? That's preposterous, right? That's just grandstanding garbage. These boxes should be in every school. Every school. In fact, I think our foundation should put a box like this in every school in the Northeast as best we can. So you can go to the Beat Obesity Foundation and review it. Yeah, Julie, I'll tell you, right? The 54% of parents who believe that the school should not mandate vaccination, I agree with you. They definitely haven't had a kid that was in intensive care, and maybe not even in a hospital. As a reminder, kids are made to be well. Our bodies are made to be well. It's just the way it is. So if you're home and you want a little project to do today, you can see if Amazon will ship you a fan in the Northeast in this weather. But if you're everywhere else, take a moment, go on Amazon, get yourself a couple of box fans, order yourself some furnace filters, and build the Corsi boxes. We should be building the Corsi boxes. There's no doubt about that. All right, so I'm at 23 minutes. I'm going to get off at 24. I'll open up. Last question. Julie, you got any questions? Jim, do you got any questions? There are a couple other people on here. With widespread testing taking a backseat, what do you think the actual community infection rate is? You know, we saw this last summer too. Testing plummeted after the southern wave because people said, I got to wait 10 days for a result. So we're chronically undersampling, and when we chronically undersample like that, there have been estimates often, the mathematical modeling geniuses say it's about a 10x from what the rate is. About a 10x rate is really what happens here. So take all your positives, multiply it by 10. That's probably the amount of infected in the community. So take your positives, multiply by 10, put that into the community, that's your community rate. It doesn't mean take your percentage and multiply it by 10, Jim. It means take your total positives, multiply it by 10, And that's roughly what your community infection rate is. And I think that's been a pretty good bellwether. When you have widespread testing, that number holds up. So when testing is way down because insurance companies aren't paying, because the PCR tests are taking a long time, because you got what? The fools at Abbott destroying their own tests. What are you going to do? It's about 10 times the rate. Take how many are positive, multiply by 10. All right, multiply by 10. A couple people on and off here. Again, this is Dr. Murphy's Hurricane Henri, Tropical Storm Henri recap, my live stream before everything goes black, because Eversource is going to mess up the power here in the Northeast, in Connecticut, and we're going to be without power for 5 days. So, do I see the local rates changing because of power outages and back to school at the same time? Yes. Yes, Julie, and that's the big issue, a resounding yes. I fully expect that what's going to happen is that everyone's going to be packed indoors today. There's going to be power outages. People are going to be home for a few days. Easy to transmit to each other, number one. Number two, we got back to school in a little while here. We got back to school in, 7 to 10 days. And so I expect in Connecticut that the rates are going to go through the roof. The rates are going to go through the roof. And what I find interesting about it, let's see if I can send this picture up. So recently, the CDC said, and this is a pack of fools, no offense, CDC, I'm sorry, but I have a big problem with what's going on there. I have a big problem with what's going on. And let me tell you what the problem is. The problem is this. All right. Oh, good. It's in downloads. It's ready. Okay. So I don't know if you guys can see these. I'll pull these up quickly. Oh, Julie, listen, if you can't test, you can't do the rest. But I want to highlight this here for you, right? So take a look at this. The CDC has said the following. The Delta wave has likely peaked across the Northeast. What? That's right. So the CDC has said the Delta wave has peaked across the Northeast, and school hasn't even gotten back together yet. Right? So when you ask the question, do I think that there's going to be a big rate go up because of the power outages and the storm and back to school? Absolutely. So any schmuck that would allow the CDC to push a press release out which said that the Delta wave has likely peaked across the Northeast again reiterates the hubris of what's going on here. People are trying to massage the message. What they should say is, our data looks like maybe it might peak, however, there are some confounding factors. That's what you have to say. Because, you know, as smart as the United States is, as stupid the United States is, we don't respond well to bull crap. Right? And guess what? Yeah, your trajectories here of the Delta wave in Connecticut look like it's tapping off, but schools haven't started yet. Like, what fool would say that before school started? Yeah, so, you know, I'll tell you, Jewel, last year, we tested schools, right? Because they were on summer vacation. They all had exposures. So we tested the children. We treated all of them as they had been exposed. In addition, we tested the teachers, treated them as if they had all been exposed because they had all traveled to high community rates. And so should we be testing the kids? Now, last year, I'm going to tell you something where I was wrong. I was wrong. I was way wrong. And I was way wrong because I wasn't advocating the antigen testing. I wasn't advocating it. And that's because the antigen testing, I was not advocating it. And I was an idiot. Michael Minna was right. Congratulations, Mikey. Congrats up there in Boston. Whose Red Sox are stinking. Sorry, Jim, but they're collapsing, like total collapse. So I didn't advise antigen testing because it missed a lot of kids that were positive on PCR. Well, the data started to come out and show that really the kids that were positive on the antigen testing were the contagious children. Yeah, sure, you could be recovering from an infection, test positive, positive on a PCR. Holy cow there. You could test positive on a PCR, but you wouldn't test positive on an antigen test. Yeah, I know. Sorry about that, Jim. But the Red Sox are collapsing. Just like this storm is. Woo! So, in all seriousness, we should have done the antigen testing and set up protocols at all schools last year. Instead, a lot of people bashed the antigen test. Part of that was because we want to be accurate all the time. But I think Michael Minna was right. I think that we should have set up a protocol like that. And this year, there should be a protocol like that. Even if not the antigen test, maybe at least the Abbott tests everywhere would be a really good way to go here. The Red Sox weren't terrible at the beginning of the year. And frankly, as a little, they were punching over their weight. They're punching over their weight. Frankly, just like the Tampa Bay Devil Rays are punching over their weight right now. But I don't know what's going on with Tampa, but it'd be interesting to see if they had a Houston Astros, trash throws like situation going on with them, because they're also punching way above their weight right now. Way above their weight. So yeah, to answer your question, I think that schools should be testing. Schools should be testing. There's no doubt about it. And I think that they should be doing it preschool, before school. We did it last year. We also did it when they returned from winter break. And some schools were actually doing saliva testing, pooled saliva testing, which, by the way, Saliva Direct, here's a shout out to my collaborators up in New Haven at Yale University, not the New Haven Health System. So at Yale University and Yale Pathology, they developed a technique called Saliva Direct, which frankly is amazing. And the Greenwich Academy School was using regular twice a week Saliva Direct testing that kept their kids safe. It's a fantastic, brilliant model to keep the kids safe. If we're going to do school, we have to do it safely. And Delta is not alpha. Delta is not wild type. We need to test. There's no way around it. And frankly, with everyone jammed in their homes right now, there's going to be a lot more carriage here. A lot more carriage. So I'm going to wrap up, guys. 32 minutes and 30 seconds on the 22nd of August, 2021, 8:41 a.m. I got to get some food together for these kids. Last shot. Any questions? I'll answer any questions here quickly, and then I'll go. Going once. Yes, Jim, you got a lot bigger fish to fry there deep in the heart of Texas. I love you. You stay safe. You stay safe. Jules, stay safe. Guys, stay safe. If you're here in the Northeast, hunker down, get ready. Rain is coming our way if you're in Fairfield County, if you're in Westchester County, if you're in on the Jersey Shore in New York City. We're going to get a lot of rain. A lot of rain, a little bit of wind, and definitely power outage. Stay safe, guys. That's right, Jewel. Let's go Yankees. Let's go Yankees. Guys, I want to thank you. You have just watched Murphy's Medical Minute. Remember, remember, remember. Stay safe. Be safe. Take care of each other. Do your best. I love you guys. Hurricane Henri. Just a big rainstorm. Stay well, and remember, we are made to be well.
With